Good morning, everyone. I am very delighted to be here and pleased to be here with Dan and Loretta to share more of the story related to what's happening in Detroit. And I really appreciate how both Dan and Loretta teed things up. As you've heard, Detroit has just emerged from the largest municipal bankruptcy. And so it's all over the front papers. We're very excited. We do see Detroit as a comeback city. And just recently in our major Detroit newspaper, the Free Press, it talks about this is going to be a great opportunity to rebuild institutions and restore neighborhoods, rejuvenate our economy, as well as restore trust. So we're very, very excited about the future of Detroit, and it doesn't hurt that the Lions won yesterday either. And we're doing pretty well with our division, so that really infuses a lot of excitement as well. What I'm going to share today is a perspective of a health system and give you a little bit of background about Henry Ford Health System, and hopefully we work with many health systems across our region, across the country, and we try to set the pace in many respects. We've had, through the leadership of Nancy Schlichting, who was our CEO, and her predecessor, Gail Warden, they have been just very passionate about how health is more than healthcare delivery services, and how we need to take health more out into the community and have that forward thinking. I also do want to acknowledge that there have been major team members throughout Henry Ford, Bill Schramm, who is our Senior Vice President of Urban Development Strategic Planning, and also Tom Habits have been very involved in this work, and they actually help to make the connections for a system that ordinarily is focused on the delivery of healthcare services. So we feel very much that Henry Ford Health System is really driving health, not just health care, but really driving health. And we are about to celebrate our centennial anniversary. Next year, Henry Ford founded Henry Ford Hospital in 1915. So, and of course, part of his approach was very much being an innovator, whether it was in the auto industry or in healthcare. And he did many innovative things, such as developing a group model and a salaried physicians. And so we very much feel that at Henry Ford that innovation is part of our DNA, and that's something that we promote each and every day. Also, the organization has very much been committed to the community from the standpoint that Nancy Schlichting, as she was developing 12 years ago her strategic framework, and of course she included all of the traditional pillars such as people and service and quality and health and research and education, but also one thing that she did very deliberately was to include a community pillar, which was not typical in a healthcare system. But she felt, as we move forward as an organization, she wanted to ensure that we had an effort related to the community where our community efforts were weight-bearing and accountable even at the board level. And you can even see here in our vision statement that took 9 months in the making and went through all kinds of focus groups and voting to determine what our ultimate vision statement would be, and is transforming lives and community through health and wellness, one person at a time, and actually even at times one population at a time. But that transformational element is key, as even Loretta mentioned during her remarks. But it's not just improving, but we have to be out-of-the-box thinkers. We have to transform our communities and find ways that we can deliberately and intentionally transform our communities. So very briefly, Henry Ford Health System is a $4.2 billion company that has 9 business units spanned across 3 counties. And we have a 1,200 physician medical group and about 2,200 private practitioners. We have about 1,500 residents that train in 40 specialties, about $60 million in foundation and NIH funds come through the health system annually, and we have a health plan with about 600 members. So we're a very complex, comprehensive, quaternary care organization in one of the most challenging cities in our nation. However, what I need to really underscore is that through our CEOs and the leadership at Henry Ford, there has been a commitment that even during those very, very, very challenging times, we feel that we're, as I said, in a comeback mode. During those very, very challenging times, Henry Ford Health System leadership made a commitment that we're going to stay in the city. We're not going to leave the city. We are committed to the city, and you'll see that throughout this presentation. And that's never wavered in the 30-plus years that I've been in the institution or part of the organization, even during my time as Surgeon General. So I'm really, really proud of that fact, and that's going to be part of, as an anchor organization, part of what I believe is going to really bring Detroit back in a very vibrant and be even more robust. I'm not going to spend a lot of time talking about health and all policies because Loretta so eloquently described it, but I'm going to talk about how we're operationalizing it as a health system, working with our partners across the city of Detroit to operationalize health and all policies efforts. Here you'll see just south of our main hospital in Detroit, we are working on there's a 300-acre redevelopment site. And as you see, it's entailed the acquisition and at times demolition. I'll show you deconstruction next of housing, so that we could really create a new future for the area just within close proximity to the health system. As you see, this is an opportunity where we've had the ability to actually deconstruct and mitigate environmental hazards where possible. And many employees have been focused, from our Focus Hope site, have been employed as to help in this deconstruction site. Not our Henry Ford employees, but employees of Focus Hope have been engaged to, in a very healthy way, to be involved in this process in terms of gaining employment. And here you'll see this is a rendition of where we expect just the 300 acres just south of our main hospital to look like in the very near future. And this is what we call placemaking. And placemaking is an important part of the vision for what we call the south of the boulevard. Henry Ford Health System is located on West Grand Boulevard. So when we talk about the major redevelopment that we're doing, it is south of the boulevard. And the goal is to blend the development seamlessly into the community to create a vibrant, walkable place where people want to be. And this comprehensive approach to community revitalization is in what we call the Midtown, not quite the downtown area of Detroit, Midtown, and I want to reference that because you'll be hearing me talk a little bit more about Midtown shortly. The initiative builds on Henry Ford Hospital's anchor status and to serve as a catalyst for additional growth and development. And you'll see when I talk about some of the other efforts that are occurring in the Midtown region that Henry Ford very much sees itself as a catalyst. We can't do it alone, we need partners, but we can certainly catalyze the economic development in those areas. Also, we see the development of a cancer center of excellence, rehabilitation hospital. But what is also going to be key in that development of that 300 acres just south of the boulevard is mixed income housing. And there's been a very deliberate effort to ensure that many of the employees that we employ about 10,000 employees right on that Detroit campus within the city of Detroit. And the need for many of those employees, particularly those that are entry levels, to have the ability to have their residence in close proximity to their work site. So very much a focus on mixed-use housing to create and improve the physical infrastructure. Also in and around this Midtown area, there's been a major effort to address complete streets. In 2012, Henry Ford Health System sent a letter to the Detroit City Council supporting a complete streets ordinance. Rates of chronic disease in Detroit are much higher than the national average, and one reason is the lack of availability and access to safe, walkable, bikeable communities and green spaces. And the National Academies recommends in one of the studies that fighting childhood obesity is establishing ordinances to encourage construction of sidewalks, bikeways, and other places for physical activity to occur. And studies have shown that when there are more walkable and bikeable places, that actually we see lower and lower rates of some of these chronic conditions. So Henry Ford Health System is not just talking the talk, but we're trying to walk the walk, or at least bike the walk where possible. In partnership with our Michigan Department of Transportation, Henry Ford has helped to install dedicated bike lanes on the streets around our main hospital campus. It's also helped to fund a feasibility study for a Detroit bike share program. What you see in this picture is an area very close to the, as you approach the hospital. It's on Trumbull Avenue leading to the hospital. And you can see new lighting, tree planting, bike lanes that Henry Ford Health System has helped install to make this one of our main entry points as we welcome visitors to our community. And also there's major effort in process for the, you'll see the Henry Ford Hospital there, the main hospital, but part of the Henry Ford campus, the corporate offices are just blocks away, and many individuals want to walk between sites. And there's a major effort to work on the overpass over a major freeway. Also, I want to mention this site here, and you'll see a couple of other renditions, is where Cardinal Health, it's called the Cardinal Health Center Project, where a major medical supply distribution company is going to be located right in and very close to the hospital. It will serve as Henry Ford Health System, the Detroit Medical Center, another major health system in our community, as well as other area hospitals. It's a $27 million construction investment. It will produce 140 new jobs, and it'll have over 270,000 square feet of floor space. You'll see an aerial view of the site here, and if you look straight up, right in this area, you'll see Henry Ford Health System. Also, this was touched on a bit too in terms of dendro remediation. As part of the Cardinal project, it includes installing sustainable landscaping, including native plants that do not require intensive watering and help remove environmental contaminants. Here is another effort related to a healthier, greener Detroit. Henry Ford Health System is working with the Greening of Detroit on a project known as a Healthier, Greener Detroit that is seeking to determine the type and prevalence of the most common public health problems in Detroit. And as you see, this collaboration has been actually with the Institute for Population Health that Loretta leads. It's mapping out the type of prevalence, the type and prevalence of the most common conditions that we see in Detroit, whether it's asthma, diabetes, behavioral health problems, or violent crime. Examining peer-reviewed research on how trees and green spaces positively impact these conditions, and making recommendations on where to put plants and trees and creating greater green space. So now I just want to spend a few minutes talking about the civic engagement elements of Detroit Future City, and that we have had over at least 2.5 decades, major efforts in terms of community outreach to engage our citizens within the city of Detroit and the outlying suburbs as well. Through this engagement and through engaging our community, there's been a major effort on equity, addressing equity. And over the last, between 2009 and 2011, we had a major, what we call healthcare equity campaign, where the goal was to ensure that health and healthcare equity were understood and practiced by our providers, by our research community, as well as reaching out into the community at large as well. So the URL listed there actually gives, you can gain access to a very comprehensive report on what we've done related to healthcare equity. But it's not just confined to the four walls of the health system. We very much reach out to populations of different races and ethnicities. We have community advisory boards that we work very closely with in order to help inform us. So it's more than a clinical or quality proposition. It's very much working with our key stakeholders within our community. Also, we've had a major effort that looks at the collection of race, ethnicity, and primary language data. We have over, the providers at Henry Ford speak over 60 languages, and we find that we serve a very, very diverse racial and ethnic community within the city of Detroit. We have the second largest Arab American population outside of the Middle East. We have a large Bangladesh, Yemeni population, large Latino population, and a large African American population. So very much understanding through self-report what the community that we're serving has been very important. Also, we've had strong community ties through our Henry Ford, several Henry Ford Hospital initiatives. One is Live Midtown, where we collaborate with Midtown Detroit, Wayne State University, and Detroit Medical Center to offer financial incentives for individuals who are willing to relocate within the city of Detroit. And this may entail employees receiving $20,000 toward a purchase of a primary residence, and up to $2,500 for purchase of or for renting of a home or an apartment. Now, these loans are actually forgivable. So after 4 years, every year a quarter of this loan is forgiven. So that $20,000 can be forgiven over 4 years if a person chooses, that's an employee of Henry Ford or of Wayne State or the Detroit Medical Center, chooses to reside in the city of Detroit. Also, another major effort related to education is what we call early college, where we engage students that are often at-risk students from underserved families. They have the ability to enroll at grade 9, complete their education up to grade 13, and with that, they'll receive a high school diploma, they'll receive an associate's degree, and they'll receive a clinical certification and are eligible for employment after grade 13. As I get ready to close, because I know we do want to have ample time for Q&A, I just want to share that we're also working very much with a workforce that can help us to, through community engagement, through the employment of community health workers. And these are liaisons between the health system as well as work very closely in the community to help bring about health. Lastly, many efforts to engage our community around bringing entertainment into the city, and this is occurring right down the street from Henry Ford Hospital. Also, we have students that have repainted overpasses that lead to our corporate building, engaging them. And lastly, we've engaged the community around creating a mosaic. This mosaic was created by about 1,300 individuals from across Detroit. Each of the little dots that you see is a tile. It's a picture that an individual in the community has drawn, and these have all come together to create this community mosaic mural that will actually live in 3 of our underserved neighborhoods. We had all four health systems involved. We've had IPH involved, our local and state health departments, and many, many other community partners to fund the creation of this mural, but also to fund the project to decrease infant mortality in our communities. You can see the 3 different houses represent the housing stock in 3 different neighborhoods. The 4 butterflies represent the 4 health systems involved. You can see the cityscape of Detroit. But in many ways, we're trying to bring connectivity to Detroit and empower the individuals within the city, but also bring beauty and art to our communities as well. Thank you so much for your time and attention. I look forward to our discussion.